So how did you get interested in public health?
I really felt like I wanted to try to wrest this question of the health of prisoners or the lack of medical care for prisoners, not just let people see it in terms of a criminal issue, like people see it as, okay, that's in the criminal justice box. And to me, when I was looking at it, I felt like, okay, these policies, when you have people who are subjected to substandard care, when you have people cycling in and out of prison, coming home in worse shape than they went in, when you have families separated, these are things that are impacting the whole community, and they're impacting the health of the entire community. So I felt like it would be really important to align myself with people in public health who are starting to talk about this mass incarceration as a public health crisis, that it wasn't just a question of criminal justice, that it was really a question of community impact, and that there were policies in place that were really harmful. And you have the system that a lot of people look to, the prison system, that this is supposed to bring us safety in the community, or this is supposed to keep our community safe, and realizing that this institution that a lot of people look to as a source of safety is in fact a source of that it's pathogenic, that it creates disease, that it creates illness, and that it reinforces disparities in health. And we've known for a long time that where you are in the social ladder, whether it's based on race or class, whether you're living in poverty or living well, that those things really determine, those socioeconomic things really determine to a certain degree your level of health. And that the ways the prison system works is it really, it keeps people, particularly when they're coming out of prison, people come out with a whole range of what a lot of us call, it's like post-conviction penalties. And people are denied, oftentimes, depending on the charges, it's difficult to get student loans. You can be denied employment based on the fact that you've been to prison. You can be denied housing based on the fact that you've been to prison. There's the one-strike housing policy in public housing. There's a lot of these barriers that are really systemic that affect people's health. So if you can't get a job, if you can't get housing, your individual health can't be stable, and the health of your community is going to be impacted. So there's ways that that's so much about the whole system of mass incarceration that it really, really, that it increases the disparities around race and socioeconomic status that are already kind of a given in the society, and it really exacerbates them. And the nature of the drug war in this country, it's really created, it was really aimed at people of color, and it's had just horrible, horrible effects on communities of color. And the vast number of, I forget the exact statistics at this point in time, but the vast majority of people who are locked up behind the drug war policies are people of color, and people come back to the community in a weaker situation than they were before they went in, less able to get a job, less able to get stable housing, families are fractured in this process. There are a huge number of African American and Latino children who are in foster care because of the drug war. People lose ties with their children, and children are actually fast-tracked into an adoption process if their parents are locked up for more than a certain amount of time. I believe it's 18 months. Anyway, I think we have to view this as a question of social justice.